Hi everyone, I want to talk about Wilms tumor. Wilms tumor. Wilms tumor is the commonest renal malignancy in children, particularly younger age group less than 15. Majority are diagnosed before age 5. Those with bilateral disease are diagnosed at an earlier age of 2 to 3. The risk is greater in blacks. These are associated with some syndromes like Sotos syndrome, Perlman syndrome, Beckwith-Wiedemann syndrome, Denys-Drash syndrome, and WAGR syndrome, that is, Wilms tumor with Aniridia, Genitourinary anomaly, and retardation mentally. WT1 gene has been identified, that is, Wilms tumor 1 gene has been identified. But I would admonish that should be careful with abdominal palpitation. The clinical features are abdominal mass for obvious reasons, because the kidney where this is going to occur is in the abdomen. And of course, that could lead to abdominal pain, hematuria, fever, hypertension, mostly accidentally diagnosed by mothers while bathing the child. So the mother will just discover that there's a swelling in the abdomen. Unilaterally most of the time, but it could be bilateral. We can make the diagnosis by using ultrasound. Ultrasound once any of the congenital anomalies is suspected or picked. You can use Doppler ultrasound for possible infiltration of the renal vein or inferior vena cava. You can do CT of the abdomen and do CT of the chest to rule out any possible metastasis. Magnetic resonance imaging could be welcome here. You can do your complete blood count and von Willebrand assay to rule out von Willebrand disease. But because by the time you are having hematuria, you want to rule out any possible cause or causes. Fibrinogen level, total iron binding capacity with ferritin or iron, because anemia of chronic disease will manifest like iron deficiency. You will want to test the liver for its function tests, like INR, PTT, bilirubin, albumin, and glucose. You have renal function tests, knowing the level of blood urea nitrogen, creatinine. You do your analysis, and of course, electrolyte assay. The possible differential diagnosis here would be neuroblastoma and renal cell carcinoma. The renal cell carcinoma is very rare in pediatric age group and could only be made histologically. As far as prognosis is concerned, when it comes to age, not much difference between the young and the old. But there is possibility of relapse when there's loss of heterozygosity. And when the cancer is presenting at higher stages, stages 3 to 5, then we're going to get worse outcome. Also, when histological report is given, then we'll make some prognostic predictions if we find the following. Number 1, if there's no anaplasia, that is the best news for the family. If there's focal anaplasia, not too good, but better compared to if we find diffuse anaplasia, which will give the worst outcome. The treatment is essentially to refer to pediatric oncologists. And the likely events that follow would be, if this is stage 1 and 2, there will be surgery and chemotherapy. Stage 3 and 4 will have surgery and chemotherapy as well. While stage 5, something different will happen. Nephrectomy of the affected side and partial nephrectomy of the contralateral kidney. You have many chemos to choose from cyclophosphamide to carboplatin to etoposide, vincristine, dactinomycin, doxorubicin, epirubicin, irinotecan, and carboplatin. Complications that we may likely be faced with are the following: surgery. Secondary to surgery, there's possibility of massive blood loss leading to shock, anemia, and so on. After healing and fibrosis, there's likely going to have small bowel obstruction. Infection could set in post-surgery. If chemotherapy has been applied, there's possibility of chemophock, immune suppression, diarrhea, hair loss, and renal impairment, cardiotoxicity, hepatotoxicity, and infertility. If radiation is applied, there's likely going to be muscle atrophy, short stature, scoliosis, and portal hypertension. How are we going to follow up here? The family physician will be doing most of the job with the family and affected child, and that will involve general physical examination, ultrasound, chest x-ray, and look out for complications of the treatment given through history and physical examination. And with that, come to the end of presentation as far as Wilms tumor is concerned. Kindly subscribe to my channel, and if you have any question or questions, kindly drop that at the comment section. Thank you.